This Good to Go segment is sponsored by Spectrum Health Medical Group.
Spectrum Health Orthopedics wants to help keep you moving. Spectrum has a long history of excellence in helping patients with joint pain improve their mobility and their quality of life. In serious cases, doctors may recommend replacement of a knee, hip, or shoulder. Some of those joint replacement surgeries are even done on an outpatient basis. And here to talk about that is Dr. Chris Sherry from Spectrum Health Orthopedics. And it's good to see you, Dr. Sherry.
Thanks for having me.
Tell me a little bit about joint replacement surgery.
Sure. Joint replacement surgery are procedures where we replace the arthritic joints with prosthetic components, usually metal and plastic, that eliminates the arthritis in the affected joint and allows the patient to return to normal daily activity without pain.
Who's a candidate for that kind of surgery?
We look for patients that have end-stage or bone-on-bone arthritis in their affected joints, patients that have daily debilitating pain that affect their quality of life. These are the patients who do best with joint replacement and return to normal activity pain-free.
It's hard to imagine the replacement of an entire joint. Can you give us a little bit of a walkthrough on what that's like?
Sure. If I have a model right here, if I could show you. If we talk about a knee replacement surgery, a lot of people think that they actually kind of cut off the ends of the bones, the top and bottom, but really what we're doing is really shaping the ends of the bones to accommodate these metal and plastic pieces. And the knee replacements, we really just reshape the end of the femur bone here just for a nice small metal prosthesis and allow space for the plastic in between, and that becomes a knee replacement. So minimal bone resection, really just enough space to put in these metal and plastic prostheses to eliminate the arthritis and allow a patient to have frictionless, pain-free motion in their affected joint.
I imagine that you exhaust all kinds of other less dramatic treatment options, right, before you get to replacing a joint.
Absolutely. We talk to patients that there's lots of different conservative measures that we use for joint arthritis. We really want to exhaust these. We talk about things like medications to help with inflammation, physical therapy to work on stretching, strengthening the affected muscles around the joints. We do injections into the joints to help with inflammation. We really look to exhaust all these conservative options and usually always use joint replacement surgery as the last step in the process to help the patient.
Let's talk about outcomes. How do you, or do you have to change your lifestyle to accommodate the fact that you've got this replacement part in your body?
For the most part, no. We tell patients that normally you can get back to doing the day-to-day things that you want to do on a regular basis, including walking, bike riding, golf, doubles tennis, things of that nature. We tell patients we don't advise long distance running with joint replacements in an effort to increase the longevity or increase the amount of time these joints last for the patients. But for the most part, patients are very satisfied getting back to doing the daily things that they want to do.
Yeah, that's amazing. How long will a new joint, that replacement last?
So the older generation of joints that we're using, we're consistently getting around 15, 20 years out of. We're using better technology, specifically better plastic pieces that have better wear rates and last longer. We're still waiting on long-term results to come back, but we're hoping that we can get beyond that 20-year threshold with the previous technology with the newer implants.
So clearly you have seen, though, that as technology has changed and you've gotten more feedback, that the equipment, so to speak, it has improved over time.
Absolutely. Technology is getting better. Our techniques are getting better. We're using multiple things to help with post-operative pain control, decreasing length of stay in the hospitals following the joint replacements, all designed to have patients have better outcomes and do well with these joint replacements.
All right, well, that is good news. And folks who want to learn more about total joint replacement surgery, they may do so by calling Spectrum Health or visiting their website. And we put all that information on ours at 13onyourside.com. Doctor, thank you so much.
Thanks for having me.